How would you describe this image? If you're like me, the first things that come to mind are probably purple flowers with an orange sky. But what if something happened to you that made those colors go away? In this video, I'm going to talk about a condition in which that actually happens, called achromatopsia. Cerebral achromatopsia is color blindness caused by brain damage, most commonly from a stroke. The effects it has on people varies from case to case, but many report seeing everything in gray, black, and white, like they're watching black and white television, or like everything has a gray tint to it. Some people have a more moderate achromatopsia and can actually perform pretty well on colorblind tests like the Ishihara test or Farnsworth-Munsell test. Some report seeing a reddish-brown tint to everything. Of the 92 patients with achromatopsia tested, 23% performed normally on the Ishihara test. Only a few showed total impairment on the Farnsworth-Munsell test, which has you arrange colors in order, like this. Links to examples of these tests can be found in the description below. Achromatopsia is very complex, and the people with it show a wide range of deficiencies. Not much was known about achromatopsia until recently, because it is hard to study for several reasons. For example, it is extremely rare and there is often extensive damage to the brain that makes it hard to locate the exact area associated with achromatopsia. One of the first well-documented cases was in 1888, and instead of sparking interest in the disorder, it sparked debate among scientists whether there could even be a color center in the brain. It wasn't until around 1990 that researchers began to take images of the brain to try to locate a hypothetical center in charge of color perception. So far, researchers have seen that achromatopsia is caused by damage to the ventromedial occipital and temporal lobes, specifically the lingual and fusiform gyri, which are these things right here. Many people with achromatopsia also have prosopagnosia, a condition in which people can't identify faces. Using scans comparing the brains of people with both achromatopsia and prosopagnosia with people who only had one or the other, a specific area was found for achromatopsia. Some people also have anosognosia, which means that they are unaware that they even have a problem. So not only can they not see color, they don't know that they can't see color. If the achromatopsia improves, so does the anosognosia. But there are also people who don't recover and they remain ignorant of their condition. For example, there was an 87-year-old man who complained about not being able to read the newspaper after a stroke. But when his physician would tell him that he wasn't properly identifying colors, he would just blame it on bad lighting. After a couple months, his condition improved, and he realized that he had, indeed, not been able to see colors. In another case, however, a man had achromatopsia that hadn't improved in 10 years, and in those 10 years he was unaware that he couldn't see color. This suggests that the area of the brain in charge of processing color also plays a role in the conscious perception of color. Another interesting fact about achromatopsia is that many researchers have found evidence that people with achromatopsia can still process wavelengths of light, the physical property that allows us to see color. It just isn't processed in the color-seeing pathway. This was discovered because people with achromatopsia can still distinguish between different colored edges, showing that wavelength is being processed in other parts of the brain, just not for seeing color. Their pupils also react to color displays, showing that their eyes are working properly and taking in the information. It is just getting lost along the way to seeing color. Sometimes, if the damage to the brain is only on one side, the person will only have one eye that does not see color. Interestingly, one documented patient suffered a stroke that damaged the color center on one side of her brain, but she had no symptoms of achromatopsia. Later, she suffered another stroke almost exactly symmetrical on the other side, and she suddenly lost color perception in both eyes. This suggests that there are strong callosal connections, or connections between the two sides of the brain, in this area that allowed one side to process the information and send it to the other side, and this was then lost when both sides were damaged. As you can see, a lot has been done in the recent years concerning achromatopsia, but many of this is still being researched and debated, and there's still much more to learn. It is important, however, for clinicians to be familiar with achromatopsia, so they can properly diagnose and treat someone when it is presented. Something to look into if you or somebody you know is colorblind is Enchroma glasses. These glasses allow people with certain kinds of color blindness to see color while wearing the glasses. And Enchroma is partnered with the nonprofit Restoring Vision, so when you buy a pair of their glasses, they donate a pair of glasses to someone in need. Information about Enchroma, Restoring Vision, and their partnership can be found in the description. Thank you for watching.